My name is Lyndon and I'm the CEO at Exercise and Sports Science Australia, or ESSA. We represent over 10,000 members, including the allied health profession of exercise physiology. And I'm here today at our national conference, Activate, where we have over 800 clinicians from around the country here to discuss research, emerging practice and innovative models of care.
My name's Howie. I'm a PhD candidate from the Centre for Heart Rhythm Disorders at the Adelaide University. I presented some of our work in pacemaker patients. It was a simple clinical question looking at the relationship between pacemaker-detected physical activity and objective exercise tolerance. I tried to tailor this to the exercise physiologists here at this meeting. It's a good opportunity for me to disseminate and share some of our research among exercise physiology colleagues. I've met some colleagues early career stages all the way up to some more senior colleagues. This is a perfect opportunity to share some of our work with the broader exercise physiology community.
Many of the members I've been speaking with over the last few days have echoed a very strong sentiment that we're hearing across our 10,000 strong membership, and that is the frontline challenges that businesses are facing in providing care to an increasing demand of the community for health service access. When the GST legislation was first introduced, exercise physiology was an emerging discipline. Soon afterwards, we were added to the Medicare benefits schedule and we are recognised as an essential health service. But unfortunately, through a mix of a timing and a legacy issue, we are still not exempt from GST, which is creating an incredible barrier to access to exercise prescription and programming for Australians. Since the GST was first introduced and exercise physiology was recognised in Medicare, our profession has grown exponentially. We now have over 9,400 accredited exercise physiologists working across Australia, helping communities every day.
Most people don't know this, and when they find out, they are genuinely shocked. But if you are someone with a health condition, then you have to pay an extra tax to do one of the best things you can do to manage that condition. You don't have to pay this tax to see your podiatrist, your physio, your optometrist, or your dentist. And you don't have to pay this tax for your medication. But if you want to use exercise as medicine to manage your condition, which has an unbelievable amount of evidence to show it does, you'll have to pay this tax. Unlike when you see any other health profession, if you want to see a clinical exercise physiologist to improve your health, you'll have to pay tax.
Physiotherapists, occupational therapists, dietitians are not subject to GST, however, exercise physiologists are. And unfortunately, it's a legacy issue. Exercise physiologists are widely embedded and recognised across the health system. We deliver care through Medicare, the Department of Veteran Affairs and other schemes, yet we're still subject to GST, which creates an incredible barrier for vulnerable Australians who need exercise prescription and programming for their health. ESSA has been proud to launch our Axe the Tax on exercise physiology because Australians shouldn't have to pay tax on essential healthcare. So we've recently launched a petition which already, early in May, we've reached over 8,000 signatures. Our goal is to reach 50,000 signatures. We have support from Senator David Pocock to table it in the Senate later this year. And we're calling on the government to recognise exercise physiology does fit the definition and eligibility for GST exemption. And with current cost of living pressures for Australians, that this is a great barrier that can be overcome through updating the legislation.
Do you know you're paying an extra 10% on exercise physiology services?
What, really?
Yeah, GST. You shouldn't have to do that. Exercise physiology is essential healthcare.
Then why are we paying extra 10%?
I don't know, you tell me, but hey, can I ask you a favour?
Yeah, what's the favour?
So there's actually a petition called Axe the Tax. They want to try and get rid of that 10%. Do you mind signing it for me?
How do I do that?
Well, here you go now.
Yeah.
And I just get you to sign this QR code for me.
Oh, what? Really?
It'll take you like 5 minutes. Not even.
Oh, perfect. Yeah, I can do that right now.
Excellent. Thank you so much. Can you help us too?
Axe the Tax.
Our call to action is for everyone to get on board with our Axe the Tax petition and to please jump online and sign. It takes 2 minutes. We're calling on our colleagues across the clinical community and clinicians, their consumers and the broader community to sign because the number of signatures matter and that's what will help get this across the line.